Hey everyone, welcome back to the Npte podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today we've got a practice question as we go through the FSBPT's published content outline. As you know, on test day, they give you questions in a variety of topics. Today's no different. We'll be talking about the lymphatic system with a practice question. On test day, you can expect somewhere between 4 and 7 questions related to the lymphatic system. Obviously, you'll want to study proportionally, meaning that most of your time, about 75% of your time, should be spent in those big 3 systems, cardio, musculo, and neuro. But definitely do not forget about these other systems, the other systems and non-systems, as they tend to be rather plaguey questions. And let's be honest, you want to get every question correct on test day, not just 75%. You want to get all of them right. And so that's my goal here with the podcast, is to help you get through the exam that way. As a reminder, though, if you're looking for a class that'll take you through all of the content you need for the exam in a fun, compassionate way, look no further than our VIP class. So the VIPT class, my VIPTs, you guys, it's really the most fun I have as I help people prepare for the exam. I've been doing this for over a decade now. In our VIP class, we have small group sessions where we get together and we talk about practice questions. And really, as far as evidence-based strategies for crushing the exam, you've got to spend time with practice questions. And that's what we do in the class. We spend multiple times each week going through practice questions in a live setting. You also get access to all of our additional material, including our 6 practice exams. This is in a full exam simulator. You get 6 exams. You can break them up into quizzes. You can take them as full exams. Additionally, you get access to our crash course, which is our popular 3-week, we'll call it a cram session, but really it's a crash course right up until test day, going through cardio, musculo, and neuro those last 3 weeks. You get access to all of our independent videos, so all of the video content where we take you through all of the content that's on the exam. I mean, quite literally take you through hours and hours and hours of content. All of this all together bundled up in the VIP plan. So if you're looking for a very robust, very compassionate, very, very effective way to study, I think you'll really enjoy the VIP class. That's the one that I personally go through. As a part of the VIP class, you get one-on-one sessions with me. Plus, like I said, a lot of live time, all the written material, get access to all of that. I mean, just a full, very robust study plan. If you're looking for a one-stop shop, that's definitely the place to go. So be sure to check that out over at ptfinalexam.com. You can find all the details and sign up. We do have ongoing enrollment. So at this very moment, we are just getting going with our VIP class for the October exam. But anytime you want to sign up, you're welcome to join as we go through each of the quarters, the quarterly Npte administrations. And so this is no different here. So as you're planning and looking down the road, a lot of you are listening to this either on clinical, you're commuting to school and back. Just so you know, we do repeat it every quarter, and you're welcome to join at any time. All right, with that, let's go and dive into our practice question for today. So this is related to the lymphatic system. As per our usual, I will read to you the question, give you a moment to respond, and then we'll talk about it together. Here we go. A patient with lower extremity lymphedema is being treated with complete decongestive therapy. After several weeks of treatment, the therapist notes that the swelling in the leg has increased. The therapist also notes multiple enlarged lymph nodes, and the patient reports paresthesias in the involved extremity. Which of the following actions is most appropriate for the therapist to complete next? So again, we've got a patient with lower extremity edema being treated with complete decongestive therapy. After several weeks of treatment, the therapist notes the swelling in the leg has increased. The therapist also notes multiple enlarged lymph nodes, and the patient reports paresthesias in the involved extremity. Which of the following actions is most appropriate for the therapist to perform next? Number 1, apply sequential pneumatic compression to the limb. 2, consult with the referring physician immediately. 3, discontinue decongestive therapy until the swelling subsides. Or 4, incorporate manual lymphatic drainage into the treatment plan. So again, what would you do? Apply sequential pneumatic compression to the limb. 2, consult with the referring physician immediately. 3, discontinue decongestive therapy until the swelling subsides. Or 4, incorporate manual lymphatic drainage into the treatment plan. Well, the correct answer here is that you've got to, anytime you see this severe or significant of a change, you're going to want to consult with the referring physician immediately. So this is not a 911 call. However, this is what I consider to be expeditious referral. Certainly a phone call or really, there's a lot that you could do here. The reason is that these are the signs and symptoms of malignancy that are starting to show up. Anytime you see a sudden onset or a fast progression of swelling, pain, paresthesia, paresis, paralysis, enlarged lymph nodes, any ulcerations that, again, are fast progression, any of these could indicate the presence of a malignancy or a cancerous growth. And the lymph node is notorious for catching and growing cancer. So anytime you see an additional or an increase in the swelling, when you would expect a decrease, if they're having complete decongestive therapy, chances are they're going to see a decrease in limb volume, decrease in lymph node size. But in this case, we see that we have an increase in swelling, multiple enlarged lymph nodes, plus paresthesia. For me, that's kind of the kicker there. If they're starting to have sensory disturbances or paralysis, paresis, at that point, you're absolutely making a referral back to the physician. So generally speaking, you would discontinue any complete decongestive therapy until cleared by the physician. The reason is you don't want to spread the cancer. So the malignancy obviously traveling in the lymph vessels. If you were to then mobilize or continue mobilizing lymphatic fluid, chances are you could further exacerbate or worsen the cancer or the malignancy. So there you go. These are the signs of malignancy. You definitely want to do an immediate referral to the physician or consult with the physician immediately and discontinue treatment until cleared by the physician. This would be the real key in the case of a malignancy. So there you go. On test day, again, 4 to 7 questions on the lymphatic system. So certainly not a huge system, but you don't want to forget about this one. So with that, we'll bring today to a conclusion. If you haven't yet, please be sure to leave us a quick review. It only takes like 1 second. You're on your phone, just whip it out. Leave us a 5-star review. It helps so much in the algorithms as we try to get the word out about the Npte podcast. Be sure to check us out anytime you're at any conferences, so like a combined sections meeting. Come and visit. It's always fun to visit at the booth. We'll be doing that in February, so we look forward to that. And in the meantime, keep a grin on your chin. I know that this is a tough process. Appreciate what you're doing. Hang in there. You got this. And as always, Will Crane fist pumps all around. So we'll bring it to a conclusion. Have a fabulous day, everyone. Talk to you all in the next one. Have a great day.